So today let's talk about urinary incontinence. It is a really common symptom in women, and just because it's common, it doesn't mean we have to accept it as normal. Now, there are two main types of urinary incontinence. There is stress incontinence, which is when you leak urine when you cough or sneeze or jump or run. And then we've got urge incontinence, which is also known as latchkey incontinence, which is where when you feel the urge to go to the toilet, you can't hold it and you sometimes end up wetting yourself. This type of incontinence is also associated with frequent waking during the night to go to the loo. Now, we often associate incontinence with old women in nursing homes, but actually the symptoms can start really early. And I've seen women in their 20s suffering with incontinence, and the statistics show that at least 1 in 3 women have issues with incontinence. And actually, I think as you get older, the numbers increase. So by the time you're 50, 1 in 2 women are suffering. So incontinence can happen through childbirth and aging, but it also happens in women who've never had children just through normal aging. There are things you can do to help. You can make lifestyle changes, so cutting out things like caffeine and alcohol, which are bladder irritants. You can do your pelvic floor exercises, and actually most women don't hear about pelvic floor exercises until they're thinking about having babies. But the time to start is in your teens, because if you have a strong pelvic floor, you prevent issues down the line. If you're perimenopausal, vaginal estrogen can help reduce the symptoms. And then there's also in-clinic treatments such as the V-Tone from InMode, the O-Shot, which is a PRP regenerative treatment, which involves the injection of PRP into the vagina to support the bladder. And if there is an element of vaginal laxity contributing to the incontinence, we can also use radiofrequency to tighten the vaginal canal.